Welcome to Mythos AI, your source for Cliff's Notes on complex subjects. Join Anna and Phil for yet another engaging conversation.
Welcome to the deep dive. Today, we're going deep into vaccines, their history, their impact, all that. We've got this document, the history and impact of vaccines, and we'll be breaking it down.
Yeah, the goal is to give you a clear picture of how vaccines have really, changed the world. We'll start way back. Before modern medicine even existed, see how people dealt with things like smallpox.
It's fascinating, right? Centuries ago, and people were already trying to tackle these diseases. The document mentions variolation, practiced in China, India, even the Ottoman Empire. What was that like?
So variolation, it was an early attempt at immunity. Kind of risky, though. Imagine they take material from a smallpox sore, like dried scabs, and they would introduce it to a healthy person. In China, they blew powdered scabs, right into people's nostrils. 10th century, we're talking, India. They used, sharp tools to introduce the smallpox manner. And the Ottoman Empire, women, called variolators, would handle it.
It sounds a little, intense. I guess when you're dealing with smallpox, though, people were desperate. Did it work, this variolation?
To a degree, it did. Often it resulted in a milder form of smallpox, compared to getting it naturally. And once you recovered, you were immune. It was still risky, of course, sometimes led to, a full-blown case of smallpox. But it did offer some protection.
So it's around for centuries in different parts of the world. How'd it get to Europe?
It's an interesting story, actually. Lady Mary Wortley Montagu, wife of the British ambassador to the Ottoman Empire, she saw variolation firsthand in Constantinople. And she was impressed. She had her own children variolated. When she got back to England, she really championed the practice, introduced it to, a whole new continent.
It's amazing how ideas, practices travel across cultures, right?
Yeah.
Influencing medicine even. Variolation was a step forward, but still risky. The real game changer was Edward Jenner, I think.
Yeah, Edward Jenner, an English physician, he really changed how we understand immunity. He noticed that milkmaids who would get cowpox, a milder disease but related to smallpox, they seemed to be immune to smallpox. And this observation led to his big experiment in 1796.
The document goes into detail about this experiment. Pretty bold, considering what they knew back then about medicine.
Oh, absolutely. So Jenner, he took material from a cowpox sore and he inoculated a young boy. Later, he exposed the boy to smallpox and, the boy didn't get sick. It proved Jenner's idea that exposure to cowpox could actually protect you from smallpox.
And that's where we get vaccination from, right? Vacca, Latin for cow, in honor of the cowpox virus.
Exactly. That's it. Jenner's discovery was huge. It laid the foundation for all the vaccines that came after, saved millions of lives, changed public health completely. And from there, the whole field just kept evolving, driven by science and, the need to conquer these diseases.
So from Jenner, in the late 1700s, we move into the 1800s, a time of, huge scientific leaps. And one name that really stands out is Louis Pasteur.
Pasteur, yeah. A French chemist and microbiologist. Made, incredible contributions. He confirmed the germ theory of disease, which was, a revolutionary idea at the time. He showed that microorganisms, not, bad air or whatever they thought back then, were the real cause of these infectious diseases.
So before Pasteur, people knew variolation kind of worked, but they didn't know why. His work explained it, right?
Exactly. Confirming the germ theory, it changed medicine entirely. It meant that scientists could target specific pathogens, develop treatments, preventive measures. And Pasteur, he didn't stop there. He was a pioneer in, the principles of vaccination, too, building on Jenner's work, focusing on vaccines for animals, anthrax, chicken cholera, things like that.
But his most famous work, of course, is the rabies vaccine. The story of how he used it to save that young boy bitten by a rabid dog. That's incredible.
Oh, yeah. 1885. A 9-year-old boy severely bitten. And rabies, back then, it was a death sentence. Absolutely terrifying. But Pasteur, he treated the boy with his vaccine after the bite, and it worked. Saved his life. It was, a turning point in medical history.
The story of that boy, Joseph Meister, it really shows the impact of Pasteur's work, doesn't it?
Yeah.
Brilliant scientist, but also compassionate, driven to help people ease their suffering.
Absolutely. Pasteur's legacy, it goes beyond the specific vaccines he developed. His methods, his discoveries, they really laid the groundwork for immunology as a whole. Inspired, generations of scientists to keep fighting these diseases.
His work paved the way for, all the progress we saw in the 20th century, right? Large-scale public health initiatives, vaccines for some of the most, devastating diseases.
Oh, yeah. One of the most inspiring achievements of the 20th century has to be the eradication of smallpox. I mean, this disease had plagued humanity for centuries, so much suffering. But in 1967, the World Health Organization launched this huge global eradication program. Mass vaccination, surveillance, containment, and incredibly, by 1980, smallpox was declared eradicated, the only human disease we've completely eliminated, actually.
It's a real testament to what we can achieve, right?
Yeah.
Working together, using the power of vaccines, a victory for science, for public health, should give us hope facing new health challenges.
Absolutely. And the fight against polio, another debilitating disease that really gained momentum in the 20th century, too. Polio mostly affected children, could cause paralysis, even death. But, well, the development of 2 different polio vaccines really changed how we approached this disease.
The document talks about Jonas Salk and Albert Sabin. They developed the inactivated polio vaccine, the IPV, and the oral polio vaccine, the OPV. And those vaccines have, dramatically reduced polio cases globally.
Yeah, Salk's IPV, using a killed virus, came out in 1955. Super effective at preventing paralytic polio. Then a few years later, Sabin's OPV, using a weakened but live virus, that came along. Easier to administer, especially for those large-scale campaigns. Both played a crucial role in, well, trying to eradicate polio.
We're not there yet with polio, right?
Yeah.
Still challenges, especially in areas with conflict and instability.
Yeah.
But the progress, it's incredible. Shows what we can do when we combine science, international cooperation, and that shared commitment to, well, to public health.
Yeah, and the success of both the smallpox and polio campaigns, they give us valuable lessons, show us the importance of, well, a strong public health system, global cooperation, being able to adapt our strategies to different places and situations.
And these achievements, they bring us to the modern era of vaccines, where we've seen these incredible advances, like mRNA vaccines, a whole new set of possibilities about a whole range of diseases.
mRNA vaccines, yeah, they're a real game changer, totally different from traditional vaccines. Instead of using a weakened or inactive pathogen, they actually introduce, well, a synthetic piece of genetic material. It instructs our cells to make a specific viral protein, which then triggers the immune response, and all without using a live virus. The speed, the flexibility, it's remarkable.
The COVID-19 pandemic, that really brought mRNA vaccines to the forefront, didn't it? Companies like Pfizer-BioNTech, Moderna, they developed those vaccines in record time. Amazing what science can do, really. Countless lives saved, I'm sure.
Oh, absolutely. The success of mRNA vaccines against COVID-19, well, it's opened up a whole new frontier for vaccine development. Scientists are looking at using this technology to fight other viruses now, influenza, Zika, even some types of cancer. It's exciting.
So as we've seen, the history of vaccines is this story of, well, continuous progress, adapting, innovating. From Jenner's discovery to mRNA, we've come a long way, but of course it hasn't been without its challenges, right?
Oh, of course not. Alongside the triumphs, there have been setbacks, ethical dilemmas, societal complexities. All these things have shaped, well, how we view and use vaccines. And understanding those challenges, it's crucial to really grasp the whole story of vaccines. So when we look deeper into, well, all the ins and outs of vaccination, you have to acknowledge that it hasn't always been, a smooth path. We've had amazing achievements, of course, but also challenges, controversies, ethical questions. All those things have shaped how we think about and use vaccines today.
Right. The document brings up one of the biggest challenges, I think. Vaccine hesitancy. People delaying or refusing vaccines, even when they're available. It's a growing concern and, well, it could really undermine all the progress we've made.
Yeah, vaccine hesitancy, it's complicated. Lots of factors feed into it. Misinformation, mistrust of, authorities, worries about safety, and all the false information spreading online through social media that really makes things worse. It's led to, well, a drop in vaccination rates in some places.
The document talks about that, the role of social media in spreading misinformation. It's scary how quickly false claims can take off, especially among people who are already maybe a little unsure about vaccines.
It's that echo effect, right? People end up mostly seeing information that confirms what they already believe, even if it's not true. It makes it really hard to have, a real conversation, debunk those myths about vaccines.
And there's also that lack of trust in, well, institutions, government, healthcare systems. The document points to that too.
Wow.
How do we rebuild that trust, especially in communities that have historically, been marginalized, mistreated by those systems.
It's a long process. Transparency is key. Open communication and, admitting past mistakes. Engaging with those communities, really listening to their concerns, responding with empathy and respect, that's crucial. And we need to make sure that information about vaccines is accessible, culturally sensitive, tailored to the needs of different communities.
The document mentions healthcare providers, too. They have a big role to play, right? Often they have that strong relationship with their patients. They can really help, provide accurate information, address concerns.
Absolutely. They're on the front lines of this issue, really. Those one-on-one conversations, addressing specific concerns, providing the evidence, that's so important. When you have those strong relationships built on trust and communication, that can make a huge difference in overcoming hesitancy.
And then there's the question of, well, individual rights versus public health, especially when it comes to things like mandatory vaccination policies. It's a tricky area, ethically and legally.
For sure. Mandatory vaccination, yeah, it's effective, raises those vaccination rates, protects the public. But it also brings up questions about individual autonomy, people's right to make choices about their own bodies. Finding that balance between individual freedoms and the responsibility to protect everyone, it's a delicate process. You have to be really careful.
The document suggests that, well, mandatory vaccination policies should only be used in certain situations. What are those?
Right. So the document argues that it's justified if the disease is a serious public health threat, if the vaccine is proven to be safe and effective at stopping the spread, and if there are no other, less restrictive ways to achieve the same level of protection, it has to be the last resort, really.
So it's not just about, the overall good, but also making sure individual rights are respected, and that you've considered other options before making something mandatory.
Exactly. Any policy that, limits personal freedom, it has to be carefully considered, only used when absolutely necessary to protect everyone. And even then, being transparent, having open discussions, explaining the reasons clearly, all that helps maintain trust, reduce resistance.
Okay. So moving on from, hesitancy and ethical issues, the document also looks at all the scientific and technological advances in vaccine development. It's amazing how far we've come since those early days of variolation.
Oh, yeah. It's been quite a journey. Vaccine development, it's really gone hand in hand with all these advances in microbiology, immunology, genetics, discovering the germ theory, figuring out antibodies, understanding how the immune system works. All of that has helped us create more and more sophisticated, effective vaccines.
The document mentions some big milestones: live attenuated vaccines, inactivated vaccines. What's the difference between those? And maybe you could give some examples.
Sure. So live attenuated vaccines, they use a weakened version of the, virus or bacteria that causes the disease. Still replicates in the body, but it shouldn't cause illness in healthy people. Instead, it triggers a strong immune response, gives you long-lasting protection.
So the body thinks it's actually fighting the disease, but without getting really sick.
That's the idea. The immune system, it goes into full defense mode, creates those memory cells that can recognize and neutralize the pathogen if you're exposed to it again. The MMR vaccine, measles, mumps, rubella, the chickenpox vaccine, those are examples of live attenuated vaccines.
And what about inactivated vaccines? How do they work?
Inactivated vaccines, they use killed versions of the pathogen. Dead, so it can't replicate, can't make you sick, even if you have a weakened immune system.
So they're generally safer for people who, might have a compromised immune system.
Right. But because they don't trigger such a strong response, you often need booster shots to keep that immunity up over time. The flea shot, the polio vaccine, IPV, hepatitis A vaccine, those are all inactivated vaccines.
The document mentions subunit vaccines, too. How are those different?
Subunit vaccines, they use just a specific piece, a subunit of the pathogen, not the whole thing. Could be a protein, a sugar molecule, something that triggers the immune response.
So focusing the immune system on a specific target, something essential for the pathogen to survive or to cause the disease.
Exactly. And by using just that specific subunit, it reduces the risk of side effects while still protecting you. Hepatitis B vaccine, pertussis, whooping cough, those are subunit vaccines.
The document talks about cell culture techniques. Mid-20th century, that was a big step forward, right, in how we actually make vaccines.
Oh, yeah. Huge. Before we had cell culture, a lot of vaccines were made by growing viruses or bacteria in live animals. Chickens, rabbits. Took a long time, expensive, and sometimes, you'd get contaminants from the animal in the vaccine. Not ideal.
Cell culture was a much more controlled, efficient way.
Absolutely. You grow the cells in a lab, everything's sterile, controlled. You can mass produce vaccines then. Polio, measles, mumps, rubella, All those became possible on a large scale because of cell culture, led to those widespread vaccination campaigns, and, well, those diseases became much less common.
And then recombinant DNA technology came along,
Oh,
opened up even more possibilities.
recombinant DNA technology, yeah. 70s, 80s, revolutionized biotechnology. And vaccines were a big part of that. Scientists could isolate and manipulate genes, create genetically modified organisms that could produce specific proteins.
So instead of, growing the whole pathogen, they could just produce the protein that triggers the immune response.
Exactly. Subunit vaccines, like the hepatitis B vaccine, that became possible because of recombinant DNA technology. It uses those recombinant viral proteins. And it's been used for other vaccines too, HPV, rotavirus.
And of course, we have to talk about mRNA vaccines. They've been, well, in the spotlight lately, especially with the COVID-19 pandemic,
Yeah.
the future of vaccines in a lot of ways.
mRNA vaccines, they're really cutting edge. Instead of using, weakened pathogens or their parts, they actually deliver genetic instructions, teach our cells to make a specific viral protein.
So our cells become little vaccine factories, basically, producing the proteins that trigger the immune response.
That's a good way to put it. And the great thing about mRNA technology, it's fast, it's flexible. You know the genetic sequence of the viral protein, you can design and produce the vaccine pretty quickly.
COVID-19 really showed us what it could do, right? Those vaccines.
Yeah.
Developed and rolled out so quickly. Science at its best, I think.
Absolutely. And the success against COVID-19, it's opened a whole new chapter in how we fight infectious diseases. Now scientists are looking at using mRNA for all sorts of things. Influenza, Zika, even cancer. It's a very exciting time.
So we've made incredible progress. But the document also acknowledges that, well, some diseases are still really tough to tackle. HIV, malaria, they've been especially difficult for vaccine development.
Yeah, those are tough ones. HIV and malaria, they have these complex life cycles. They mutate quickly. They're really good at evading the immune system. HIV, for example, it attacks the immune cells themselves. Makes it really hard to develop a vaccine that can actually target it effectively.
And malaria, spread by mosquitoes, it has a complex life cycle too, multiple stages, in both the mosquito and the human. Hard to develop a vaccine that can hit all those stages, prevent infection.
Right. But despite the challenges, there are researchers all over the world working on this. They're trying new approaches, vector-based vaccines, adjuvants, genetic engineering, trying to overcome these hurdles, bring hope to the millions of people at risk.
So the story of vaccines, it really is a story of human ingenuity, isn't it? Scientific progress.
Yeah.
This constant search for solutions to protect ourselves from these diseases. But it goes beyond just individual health, right? Vaccines have had a huge impact on society as a whole, economically, culturally.
Oh, yeah. Vaccines have shaped not just individual health, but the well-being of whole communities, countries. They've helped increase life expectancy, reduce child mortality, made us healthier overall. Their influence, you see it everywhere.
Okay, so we've gone through this incredible history of vaccines, right? From ancient practices all the way to, those modern breakthroughs. And we talked about the science and the ethics, all those challenges that have shaped how vaccines have developed. But now I think it's time to really zoom out and look at the big picture, the societal impact of vaccines. How have they really changed the world around us?
Yeah.
Well, the impact of vaccines on society is, it's truly remarkable. It goes way beyond just individual health. It affects the health, the economic well-being, the social fabric of whole communities, entire nations. Vaccines have played a huge role in increasing life expectancy, reducing those child mortality rates, and just improving the overall health of populations.
Yeah, and the document, it highlights some pretty striking statistics. Diseases like measles, diphtheria, tetanus, whooping cough, they were once major killers, especially for children. But now, in countries with high vaccination rates, they're rare.
It's hard to grasp sometimes the scale of the change vaccines have brought about. Imagine a world where those diseases were still running rampant, killing millions of children every year. It's a grim thought, isn't it? Vaccines have given us the power to protect those most vulnerable members of society, to build a healthier future for everyone.
The eradication of smallpox, that's the ultimate example, right? A disease that had haunted humanity for centuries, gone, completely wiped out. It's a testament to the power of vaccines to eliminate diseases from the planet. A victory for science, for public health. It gives us hope for what we might be able to achieve in the future.
The eradication of smallpox was a truly global effort. It took collaboration, innovation, this unwavering commitment from so many people, so many organizations. It showed us what human ingenuity can do, the transformative potential of vaccines, and the lessons we learned from that campaign, They're still guiding public health efforts today.
And then there's the fight against polio.
Yeah.
Still ongoing, but the progress has been amazing. The development of both those polio vaccine, the IPV and the OPV, they've led to, a dramatic reduction in cases worldwide.
Yeah, we're close to eradicating polio, and that's another great example of what vaccines can do. It shows the dedication of researchers, healthcare workers, volunteers all over the world, all those people working to vaccinate children, to stop this debilitating disease from spreading.
The document makes a point of saying that vaccines don't just save lives. They also have these huge economic benefits. Preventing diseases means lower healthcare costs. Less money spent on treatment, hospitalization, long-term care. It all adds up.
Right, and the economic impact is often overlooked, but it's massive. When people are healthy, they can work, contribute to the economy, support their families. And when healthcare costs go down, that frees up resources that can be used in other areas. Education, infrastructure, social programs. It's a win-win.
The document also highlights how vaccines help promote equity, access to healthcare, especially in low-income countries. Global initiatives like Gavi, the Vaccine Alliance, they've done incredible work in making sure that children everywhere, no matter where they live, have access to these life-saving vaccines.
Gavi, it's an incredible partnership. Governments, international organizations, the private sector, philanthropists, they've all come together to fund and support immunization programs in developing countries. And their work has had a huge impact on child mortality rates. It's helped narrow that gap between rich and poor countries in terms of access to these essential vaccines.
And new vaccines have been introduced too, like the ones for pneumococcal disease and rotavirus, those target diseases that hit children in developing countries especially. It shows a commitment to health equity, using vaccines to make a difference.
Those vaccines have been game changers, no question. Reducing the burden of those diseases, preventing death and disabilities, giving children a better chance at a healthy life.
To really dig into the impact of vaccines, the document has these case studies of different vaccination campaigns, showing the successes, the challenges, all the lessons learned.
Yeah, the global eradication of smallpox, like we talked about, it's a powerful example of what we can achieve when the world comes together. Coordinated action, scientific innovation, and that absolute commitment. It's a model for how to tackle these huge public health challenges. Strong leadership, being adaptable, making sure everyone is reached. Those are the key takeaways.
The polio eradication efforts, they're still going on, facing different obstacles. But they also teach us valuable lessons. The campaign has shown how important it is to overcome those logistical hurdles, reaching remote communities, making sure vaccines are stable in tough environments.
Polio eradication has also shown us that you have to engage with communities, build that trust. In some areas, there are rumors, misinformation about the vaccine. That leads to resistance, hesitancy. To overcome that, you have to work with people, address their concerns, build confidence in the vaccine, show them it's safe, it's effective.
And then, of course, there's the COVID-19 pandemic, a huge challenge, unlike anything we've seen before. But it also showed us how fast science can move, how ingenious it can be, the speed at which those mRNA vaccines were developed, deployed. It was remarkable, a real testament to scientific collaboration, to the power of technology.
The pandemic was a stark reminder that infectious diseases, they're still a threat. But it also showed us that science can rise to the occasion, respond to these global crises. Developing safe and effective vaccines in record time, it was a triumph for humanity. And it underscores why investing in scientific research is so crucial.
Looking ahead, the document points to some really exciting areas of innovation in vaccine development. Artificial intelligence, big data, they're transforming how we research vaccines, helping scientists find new targets, predict how the immune system will respond, design better clinical trials.
AI and big data, they're changing everything, really.
Right.
And vaccine development is no exception. We can analyze huge amounts of data now, spot patterns, make predictions. That would have been impossible just a few years ago. It's speeding up the whole process of discovery, leading to new and improved vaccines.
And then there's this idea of universal vaccines, right? Offering protection against multiple strains or even different species of a pathogen. Imagine a single flu shot that lasts a lifetime, or a vaccine that protects against all coronaviruses, even ones we haven't encountered yet.
Universal vaccines, that's the holy grail. It's a huge challenge, but so promising. If we could develop those, it would revolutionize how we prevent disease, long-lasting protection against a wide range of threats. It's an area where we're making real progress, and I think we'll see some breakthroughs in the years to come.
The document also stresses the importance of a One Health approach to vaccination, recognizing that, Human health, animal health, environmental health, they're all interconnected.
Yeah, the One Health concept. It's about understanding that we live in this complex ecosystem. The health of humans, animals, the environment, they're all intertwined. So when we talk about vaccination in this context, it means things like vaccinating animals to stop the spread of those zoonotic diseases, monitoring pathogens in wildlife, and working together across different sectors to tackle these health threats holistically.
So our deep dive into this world of vaccines, it's been a journey, hasn't it? It's a story of human ingenuity, scientific progress, societal transformation, from those ancient practices to the cutting-edge technology we have today. Vaccines have shown us, again and again, that they can save lives, improve health, make the world a better place.
And as we face new health challenges, it's that ongoing innovation, that equitable access to vaccines, and that commitment to building trust in vaccine science. Those are the things that are going to create a healthier future for all vaccines. They're not just a scientific achievement. They're a symbol of hope, a sign that we can overcome these preventable diseases, that we can reach our full potential as a species. It's been a pleasure diving into this topic with you.
And to everyone listening, we hope this deep dive has given you a better understanding of the history, the impact, the future of vaccines. Maybe it's even sparked your own curiosity, inspired you to explore this fascinating field, to see how it shaped our lives. The quest for a healthier world through vaccination, it's a global effort, and it continues. Thanks for joining us.
Thanks for listening to Mythos AI. Stay tuned for more concise insights. And remember to hit the like button and subscribe for future episodes.